All right, let's get right into it. We are breaking down a really surprising policy announcement from Donald Trump. And it's about something you probably never thought you'd hear in a presidential speech: psychedelic drugs. And there you have it, right from the source. This is the core of the announcement, and it's a huge signal that we're talking about something, well, different. The whole idea is to unlock new and what he calls potentially life-changing treatments for people with severe mental illness. So to really understand what's going on here, we're going to walk through 5 key parts. We'll start with what exactly was announced, then we'll get into the why behind it, how it's all supposed to work, the very interesting cast of characters involved, and finally, how this all ties into some other policy ideas. Okay, first up, let's just deconstruct the announcement itself. What is this all about? The key word here is speed. Trump's whole argument is that these new treatments show incredible, life-changing potential, and he's saying that making people, especially our veterans, wait years and years for them to become available is just unnecessary. So he wants to fast-track the whole process. And that brings us to the real why of all this. The main reason, the driving force that was presented in the speech, is the tragic health crisis that's happening among our military veterans. And this number really puts it all into perspective. The speech claims that since 9/11, for every 1 battlefield death, we've had more than 21 veteran suicides. I mean, just let that sink in. It's an absolutely staggering statistic, and it's meant to hit home just how urgent this problem is. And this quote ties that horrible number directly to the policy. So this whole thing is being framed not just as some medical reform, but as a direct answer to what he calls a national tragedy. It's about bringing new hope to people who are really, really suffering. So you might be asking, how is this actually supposed to work? What does the policy do? Well, that brings us to the nuts and bolts of the executive order. You know, the goal is to cut right through all the bureaucratic hurdles, and it does that in 3 main ways. First, it tells the FDA to speed up its review process for these breakthrough psychedelics. Second, it pushes for better data sharing between the FDA and the VA, which just makes sense. And third, it's designed to make it way easier to reclassify these drugs once the FDA gives them the green light. All right, now for the who. Because honestly, one of the most fascinating parts of this whole thing was the incredibly diverse group of people Trump brought up and credited for pushing this idea forward. And this coalition he mentioned, it is really something else. You've got media personality Joe Rogan, who Trump said actually called him about this. He also floated putting his political rival, Robert F. Kennedy Jr., in charge of Health and Human Services, and having Dr. Oz run Medicare and Medicaid. And then he rounded out the group with respected doctors like Makary and Bhattacharya, and decorated Navy SEAL veterans Marcus and Morgan Luttrell. I mean, talk about an unlikely alliance. Now, this big announcement didn't just happen in a bubble. Trump used it as a jumping-off point to connect this reform to some of his other big ideas on healthcare. For instance, he specifically brought up a compound called Ibogaine. And just for context, this is a psychedelic that was the focus of a really recent Stanford study that involved special operations veterans. And the results from that study? They're pretty jaw-dropping. He cited an 80 to 90% reduction in symptoms of depression and anxiety in just 1 month. And right after that, he announced a new $50 million federal investment to push this research even further. And in a totally classic, off-the-cuff Trump moment, right after hearing about that 80 to 90% success rate, he actually turned to the doctors on stage and joked, "Can I have some, please?" Now, it was a funny moment, sure, but it also kind of underlined his personal buy-in, you know? It made this abstract policy feel a lot more tangible. From there, he kind of zoomed out. He linked this whole idea of shaking up mental health treatment to his bigger battle against the pharmaceutical industry and his goal of lowering drug prices for everybody. And to really hammer this point home, he told a story about a friend's experience with the drug Ozempic. Get this, the cost was just $87 in London, but in New York, $1,300 for the exact same drug made in the exact same factory. It's a really powerful example of the kind of price differences he wants to go after. Then he made another connection, this time to a law from his first term called the Right to Try Law. You might remember, this is the law that lets terminally ill patients get access to experimental drugs that haven't gone through the whole long FDA approval process yet. So he's basically framing Right to Try as a successful test run for this new executive order. The logic is pretty clear. If we're already letting terminally ill people access experimental drugs, then why on earth wouldn't we apply that same thinking to give our veterans access to therapies that could literally help them reclaim their lives? And that really gets to the heart of it all. When you strip away the politics and the policy details, the big promise here, the ultimate goal, is to give people who are suffering a real chance to finally get their lives back. Which, of course, leaves us with the million-dollar question. Is this the start of a genuine medical revolution that's trying to solve a true national crisis? Or is it a brilliantly calculated political spectacle designed to win over a really wide range of voters? And that right there is the question at the very center of this whole surprising policy shift.